So this is the radius bone. The radius bone we have are 2 in number. One for the right side, one for the left side. Radius forms the bone of forearm region where it joins with the ulna bone. This is the ulna bone, and they too are the bones of the forearm. The radius takes the lateral part and the ulna takes the medial part. Coming to the demonstration of the radius bone, it's a typical long bone. It's a typical long bone which has the upper end, a shaft and a lower end. When we come to the side determination, the upper end will always have a circular head and the lower end will have a flat surface. Coming to the upper end has a circular head. This is a circular head. Why it is called a circular head? As we can see, the head is circle in shape. It joins here with the capitulum of the humerus and they form a joint which is called as radiohumeral joint. This constricted portion of the bone, this is known as the neck of the humerus. So, and upper end we see the head, the neck, and here we see a rough impression. As we can see, it is in the medial which is joining with our ulna. So this impression is called as radial tuberosity. The radial tuberosity joins here with the ulna to form another joint. This is called as superior radioulnar joint. Now, when we talk about the shaft, it is a long part of the bone, longest part, cylindrical shape. So we have in shaft region 3 borders and 3 surfaces. The sharp margins are the borders. So this is the anterior border. This one, when we take the head, we come down, we get an anterior border. From the back side, if we take the deltoid tubercle, we get another border. This is the posterior border, and this is called as the medial border or interosseous border because this part will form with the interosseous membrane. This is the sharpest border, which is the medial border. Next, we get some flat surfaces. These are the flat. This is called as the anterior surface. This is called as this is the anterior surface. This is the posterior surface, and this is the lateral surface. This is the lower part of the bone. The lower part has 5 surfaces. As we can see, this is the anterior surface, which is a smooth. So as per side determination, this is the anterior part of the bone and this is the posterior. So this is called as the smooth surface where all the artery, vein, ligament will pass. This is the anterior surface. Next, this is the medial surface because this is going to join with the head of the ulna. So this is a notch. We can see here, this notch is called as the ulnar notch. Why? Because it joins with the ulna like this. Next, when we turn, this is the posterior surface where you can see a tubercle. So this tubercle, so this is the deltoid tubercle. So this is an indication for the posterior side. Next, we see a sharp spine-like structure. So this is called as a styloid process, which takes in the lateral surface. When we go down, we see 2 impressions. One is the lunate, another is the scaphoid. Lunate and scaphoid are the bones of the carpal, and this radius bone joins with the carpal to form the wrist joint, which is otherly called as radiocarpal joint. So in the medial part, in this ulnar notch, there is another joint which is called as inferior radioulnar joint. So this is overall the anatomy of the radius bone.